Welcome back. If you're joining us right now, we were talking about dental cosmetic and we are with Dr. Akanksha Tumar, right?
Right. Akanksha.
Akanksha. That's a very
tricky name.
Tricky name, yeah. But yeah, as before the break we were talking about bridges, we also talked about crowns and veneers.
Yes.
And right now we're moving forward now. And so why would somebody trim a healthy teeth to replace another teeth?
Okay, talking about bridges, that's the only way to replace a tooth with a bridge. If there's a tooth missing, as I explained to you before, we can't put anything in the air just like that. We need support. We need support from somewhere. So in bridges, we take support of the adjacent teeth, which are healthy. We trim them and then we go about it. So, but there's a it's actually not very new. We've come up with a new procedure which is called as dental implants, in which we don't take support of adjacent teeth.
Before we go to the implants,
yes.
Just a slight concern. If you trim a healthy teeth, is it not affected? Like, don't you disrupt its
definitely, a natural tooth is natural.
Yes.
Yeah, we are definitely, when you're cutting it, we are actually cutting the enamel, which is hardest part of the tooth.
Yes,
we are interrupting with a natural tooth, definitely. That's why we've come with this thing of dental implants.
Yes.
So we don't have to cut a sound healthy tooth. Yeah. In dental implants, we take support from the bone instead of taking support from the teeth. Yeah. So basically what implants are, we put titanium screw in the bone. That screw binds itself to the bone, and after some times, like maybe 30 to 40 days, when tooth has binded itself well to the bone, we put an abutment on top of that, like a tooth on top, artificial tooth on top of that. Yeah, those are dental implants.
Talking about the factors that, what are some of the factors that you take into consideration when somebody comes in for an implant? Is there a particular group of people which you won't do, like you name the diabetic patients?
Yes.
Any other group that you won't?
Yes, diabetes, hypertension, periodontal health of the patient. These are the main factors which we look into, and obviously the cost of implants, it's on the higher side. Yeah, that is also one of the factors.
And why would you not consider these kind of patients who are having diabetic? Is there any relation to why, to their status health-wise that
healing process is really slow in diabetics. Yeah, that is the reason we're putting a titanium screw in the bone. As I told you, the process of the implant, the screw has to bind itself. Yeah, and it will fail if the patient is diabetic. Yeah.
Do you have any pros and cons for such? Any pros, like any advantages or disadvantages for?
The advantages of dental implants is that we are not touching the teeth which are healthy and sound. Yeah, they are there. We are not cutting them. We are not touching the enamel. That is one of the biggest pros of implants. Yeah.
That is the pro.
Yeah.
Con, anything that has an advantage also has to have a disadvantage.
There is yes. Okay, disadvantage, if I would say, is it's a bit on the higher side, like the expensive side. Yeah.
Or
not everybody can go for something like dental implants. Yeah.
And when you talk about these, then, or let me ask this in another way. What about the risk factor? The risk of doing all these, or let's have an umbrella of the dental or smile correction.
Right.
Do we have any risk attached to them?
There are no risk factors otherwise. All we are with smile correction, all we are doing is giving you better aesthetic, like an aesthetic smile, which makes you more confident, definitely. So as such, there are no risk factors involved to that. Like for veneering, there are no risk factors to it. Yeah, we are just masking your teeth. Yeah, so scaling, we are just cleaning your teeth. Exactly. So crowns and bridges are just a way to replace your teeth. So there are no risk factors as such.
And then when we talk about all these processes, they look very much complicated, and the machines that go into it are very much complicated also. So don't we have a risk of maybe quack doctors coming in to bring in other things into this? What do you have to comment about that?
Definitely, it's really sad. I mean, we hear a lot of times, that there are quacks working on the patients and they actually do spoil the cases, because we've studied all these years. We know the anatomy of whole body, of the face. We know where the nerves are. We know how it works. So I don't support that. It's very sad how quacks are actually coming in and they do extractions just like that, and they're putting dentures and these things which I'm sure they don't even know about what they're doing. Yeah.
And if you are an expert and you have fear for that, what about a common Mwananchi who is out there, a common person?
Yes.
What would you advise to such people?
I would just advise, please don't go to these quacks. Whenever you're going to go to a qualified professional dentist. And go for your dental checkups every 6 months. They're very important because you have no idea what's going on in your teeth. We as dentists, when we have a look, we can tell you, because generally patients come to us when it's the last stage of the infection. Yeah. So, last stage of the infection is when you experience toothaches and all that, and you're like, okay, something is happening, let me go to the dentist. It's too late. That is when we have to jump to more complicated procedures like root canals and those things. So if you come and visit us every 6 months, we can tell you if there's any initial cavity or anything which we can work on, so we save your tooth from going and, from the further damage.
Then talking about all this, then cost also has to come in. How easy or how cheap are these services? Access, in terms of access.
Every procedure, the cost of every procedure is different. Mm-hmm. Yeah, because I think a lot of hard work goes in when we are dealing with teeth. So yeah, it's different for every procedure if you're talking in terms of the cost. Yeah.
Then also we have myths and misconceptions that some group of people may be having about all these things. Maybe we have pregnant women who are a little bit drawn back of not going to a dentist at some particular trimester when they're in a particular trimester. Mm-hmm. Do you also have any concerns about that, and what would you tell somebody?
It's just when the pregnant women come to us, first there are the dental problem increases in pregnancy for a lot of reasons, and then another thing, when the pregnant women come to us, it's just that we have to be bit careful. We can't send them for x-rays because they're pregnant. There's a certain group of medications which we can't keep them on. Not that we can't do procedures when they're pregnant. We definitely can. Yes.
And as we come to the end of this, what would you tell us a little bit about the type of food that somebody may eat, and how it is related to also these? I know we mentioned it earlier on as we started the interview, but what are some of the things that somebody may check out for? The type of foods, what are the do's and don'ts in terms of the kind of food that somebody may eat after these procedures?
After the cosmetic procedures?
Yeah, after the cosmetic procedures, yes.
Just be careful of drinking a lot of tea, a lot of coffees, because they tend to stain your teeth if you've undergone a procedure like veneering and things like that. So be careful. If you're using a lot of turmeric in your food, you have to be careful about that, because that also might stain your teeth. Sodas are what stain your teeth. So yeah, these are the things you have to be careful about. Yes.
Finally, as we wrap this up now, any final words that you may be having in terms of all that we've talked about? We've been talking about oral hygiene. We've talked about cosmetic dentistry.
Right.
Any take home that we may go with right now?
All I would say is teeth are really, really important part of our body, of our system. So just take care of them. Natural things are natural. But I see a lot of patients coming to me, if they're in pain or there's anything, all they say is just remove it. I don't want my tooth. They don't realize how important it is. So, but we as dentists, we try our best to save them as long as we can. Like that is removal, extraction is the last resort. Yeah. So eat healthy food, eat fibrous food, brush twice a day, and I would suggest in the morning brush after the breakfast. Yeah, and don't use very hard bristle toothbrushes because they harm your enamel. Your enamel is very, very important. Yes, yeah, these are some of the things I would like people to keep in mind. And do visit your dentist every 6 months. It's really important for the checkups. Yeah.
Thank you very much, Dr. Kamshi.
Most welcome.
Yeah, thank you.
You're most welcome.
So you've heard from her, our expert, in-house expert herself, that the simple things that you do really matter. Brush your teeth twice a day. Visit your dentist after every 6 months because your teeth is very important. I've been your host, Omo Nyango, and this has been Focus on Health. I will leave you with the Did You Know segment. Bye bye. See you next time.
Facts you didn't know about your tongue. Brushing. Your tongue, in addition to brushing and flossing your teeth, will help you have a clean and healthy mouth. Has 8 muscles. 4 muscles allow your tongue to change shape and the other 4 allow your tongue to change position. These muscles move your tongue in different directions and help you speak.